Hello, I am Karen Bell, lead presenter of this work entitled Balance Function, a potential early indicator of mild cognitive impairment. This project is part of a body of work aimed to identify an interdisciplinary, non-invasive protocol that will enhance early detection of cognitive impairment among older adults. Cognitive impairment occurs on a spectrum with normal cognitive function on one end and severe impairment or dementia on the other end. In between these two states is mild cognitive impairment, or MCI. MCI is conceptualized as a transitional state between normal cognitive function and dementia. Early detection of cognitive impairment would provide an opportunity for early intervention, thereby delaying the progression to severe cognitive impairment. Cognitive screening tools are useful for detecting cognitive impairment. However, few older adults report receiving routine cognitive screenings or evaluations. This highlights the need for enhanced approaches to the early detection of cognitive impairment. Deficits in sensory and motor processes, such as balance function, can occur in the early stages of cognitive impairment. The overall goal of this study was to identify elements of an interdisciplinary sensory and motor assessment protocol for use in the early detection of cognitive impairment. This study examined the potential for balance function assessment to differentiate older adults with and without MCI. A secondary purpose was to explore associations between balance function and spatial ability. Balance function was assessed in three domains: oculomotor, vestibular, and functional. Oculomotor function was assessed using video nystagmography. Peripheral vestibular function was assessed using vestibular evoked myogenic potentials, the modified clinical test of sensory integration and balance, the Fukuda stepping test, and caloric irrigations. Functional balance was assessed using the timed up and go and functional reach tests. To explore associations between balance function and spatial ability was assessed using the hidden goal task, a computerized test of spatial navigation. 42 participants comprised three groups. Participants aged 60 and older were recruited from the Keys to Staying Sharp randomized clinical trial. Young adult participants aged 18 to 40 were recruited from the greater Tampa Bay area. Young adult data were used to establish a normative reference. The Montreal Cognitive Assessment was used to initially assess cognitive function in older adults. Older adults who scored 26 or higher were deemed cognitively normal older adults, or CNOA. Those who scored 25 or lower completed additional standardized neuropsychological testing and a physician's exam to confirm a diagnosis of MCI. Our results showed the young adult group had shorter saccade latencies than either CNOA or MCI groups. The MCI group showed a higher mean vestibular asymmetry than either young adult or CNOA groups. The MCI group also showed poorer performance on the timed up and go and functional reach tests. Specifically, the MCI group showed longer completion times for the timed up and go test and less displacement on the functional reach test. compared to young adult or CNOA groups. Group differences on the hidden goal task were also non-significant. Linear regressions showed vestibulo-ocular and vestibulospinal reflexes were significantly associated with functional balance and spatial ability, respectively. The present results indicate older adults with MCI may show increased vestibular asymmetry and poorer functional balance. Our results provide evidence in support of the development of an interdisciplinary sensory and motor assessment protocol aimed to differentiate CNOA and MCI groups. Present findings combined with the current literature suggest that such a battery should minimally assess P2 and P3B event-related potentials, central auditory processing, and balance function. A clinical battery of this nature would be most beneficial when current approaches to detecting cognitive impairment are unavailable or unattainable. Importantly, clinical test batteries that could be administered by specialists across multiple disciplines during routine office visits may result in an increase in timely referrals for comprehensive cognitive testing for those with clinical findings suggestive of probable MCI. Additional research is needed to examine the co-occurrence of both sensory and motor abnormalities in MCI groups. Thank you for your time and attention. I will take questions and comments offline.